The government has unveiled a framework to facilitate access to the Social Health Authority benefits for Kenyans seeking medical services abroad. The move is aimed at addressing challenges that have left some Kenyans stranded abroad after SHA failed to settle their medical bills. But according to Peter Kairanga, Kenya's oldest heart surgery survivor who requires to travel to India for treatment, the majority of facilities there require advance payment. NTV's Rose Wangoi brings us details into a report that has raised public debate over the role of the Social Health Authority in providing universal health coverage in the country. Let's listen to that report.
Peter Kairanga has been battling heart disease since childhood. At a tender age, he was diagnosed with tetralogy of Fallot, a rare and life-threatening combination of heart defects that left his blood dangerously low in oxygen. Kairanga was one of the lucky few to undergo a groundbreaking operation in 1979 at Kenyatta National Hospital at the age of 9. However, 4 years ago, he started having problems with his kidneys and is on dialysis twice a week.
Since I have two problems, there's a heart problem and there's a kidney. Now, the doctor advised that I should first get my heart fixed so that I can have my kidney fixed. The kidney needs a transplant. The heart needs some surgery to correct a valve problem.
To access the life-saving medical and surgical procedures, Kairanga is hoping to travel to India for further treatment.
And I've been advised to go to India because they're not able to do the other surgery properly here because of the complications.
The Ministry of Health has rolled out a new structured framework to guide Kenyans seeking specialized medical treatment abroad under the Social Health Authority SHA. In a statement, Health Cabinet Secretary Aden Duale said the move marks a new era in accessing life-saving procedures unavailable locally. The approvals for overseas treatment will undergo a peer review process to ensure medical necessity with only proven and conventional therapies considered.
So far, I've checked 8 hospitals all over India, and barely they keep saying you either pay cash or SHA gives you money from here to go and pay because they don't want to deal with them directly.
The government has capped the maximum payable amount for treatment abroad at 500,000 shillings subject to review after rich negotiations with accredited international providers. According to Kairanga, he hasn't managed to raise even 1%. He notes that as the days go by, he grows weaker.
I've been trying to raise money and I've been able to raise, thanks to everyone who has helped, 1.4 million shillings. But the total amount is 7 million. I was hoping they'd even try and meet us halfway if the worst comes to the worst. Even if possible, they could pay everything because I've been paying SHA for the best time. Actually, even now I'm up to date. I've paid up to 2027.
Since the SHA rollout in October last year, there have been reports of more people stranded in hospitals abroad over delayed disbursement of funds by the Kenyan government to offset their medical fees. The ministry has identified 36 healthcare services not available locally, which Kenyans will now be allowed under SHA.
Bearing in mind that the hospital needs to check you again and then I'll give you a proper figure, proper quotation. And the SHA insists that you have to know about the amount before you leave. It's a catch-22 situation. You don't even know where to go. I don't know why they give these policies without even consulting the persons who are going, or even maybe, I don't know, how they come up with these things of deciding how they're going to charge. Because if they came to the hospital and found us who are sick, they'll tell them the real picture, they'll show them the real picture.
For now, Peter Kairanga faces a life-threatening situation and is hoping to raise 5.6 million shillings to enable him travel abroad for treatment. Rose Wangoi, NTV.